advice and opinions expressed by the host of Autism Live and her guests are meant solely as suggestion and should not be in any way construed as child-specific advice. Any choices you make in determining your child's treatment are completely at your own discretion.
Dr. Doreen Granpeesheh is the
Dr. Doreen is an expert in autism.
Doreen Granpeesheh.
Dr. Granpeesheh.
Dr. Doreen Granpeesheh.
Dr. Doreen Granpeesheh is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen.
Good morning and happy Valentine's Day to everybody. I'm Shannon Penrod and I'm here with the fabulous and wonderful Dr. Doreen Granpeesheh for Ask Dr. Doreen. We were just commenting on the fact that it's very interesting, and I said Vulcan mind meld, that we both made the decision this morning to wear pink, and then we both put on blue necklaces.
That's right, which is so
lights.
interesting. Good morning, everyone.
Good morning. And good morning to you.
Good morning to you.
And happy Valentine's Day.
Thank you, and you too.
I'm so excited to be here with you this morning.
Me too. It's great that we ended up doing this on Valentine's.
Yes,
It's
it
fun.
is. So we're going to be live for the next hour. For those of you who don't know Dr. Granpeesheh, she is a true expert in the field of autism. She's been working in this field. I think we decided the other day that it's officially 45 years.
I think it is, right? Yes,
Yeah.
because we're in 2023 and I started 78, yep.
Which, you know, is easier to say because when you say 40, everybody assumes that you're saying 14 because you don't look like you could have done anything for 40 years. But yes, she's been working in the field for 45 years. That gives you some pause. And I know we all want her skincare regimen. But she has been working in this field, and notably she's been working with all kinds of people in this field, from very young, even babies, up through senior citizens, everything in between, and the caregivers, as well as the individuals on the spectrum. And I always like to remind all of us that she has been at the forefront always of reminding everybody that it's individuals, that we can't group everybody together. And I'm going to get T-shirts at some point made that say it has to be fair, Dr. Granpeesheh, Dr. Doreen, because it's the thing that I find myself quoting more than anything else that you say, more than anything that anybody says, whenever anybody's talking to me, because it cuts right to the heart of everything. If it's not fair, then what is anybody doing? So I adore you.
Oh, thank you. That's so nice.
And I adore that the work that you do, and for making that clear to me and others on this pathway.
There's so much in our language, Shannon, that matters, you know, like the way that we look at things. A few days ago, I was reading something online, and a BCBA had written, I think it was a BCBA, it could have been a psychologist. It was someone who was probably not a BCBA, actually. I think it was a psychologist who had written something that said, instead of saying a behavior is attention seeking, try to look at it as connection seeking. And I thought, wow, just one word, what an amazing difference it makes to look at things in a different. Me too, right? That's beautiful.
Adopt that from now on.
Right.
It is beautiful.
Right.
How important is that?
Yep.
You've been posting all kinds of inspirational things.
Yes.
I saw one yesterday that really registered with me and like made me go, okay, get that grateful on.
Yeah, the one that said, about like if you have what you were looking for, that one? Yeah.
Yes.
Yeah.
Because there are times right now when I can, you know, I'm a drama queen. If people don't know that, you should know that. I'm very sensitive to everything, and everything is this huge thing that has to be overcome. I'm a drama queen. And there have been times lately when I'm like, because Jem's in college, and it's a lot.
Yes.
And I have to, like, you know, it's been my dream that he wouldn't have to take out student loans, and so coming up with the money for that and getting him where he needs to get and doing. And then yesterday when I saw that, there was a time when he was 4 where I would have cried, and I did cry and pray and rock and pray and say, please let this child be someone who has that open to him. Not that he has to go to college, but that's a possibility for him. Don't take that away from him. Please help me to do things so that does. And I thought, where is my gratitude today?
Yeah, just thinking about, you know, the reason I put that up there, by the way, like, and it was something about just, you know, think of the time that you wanted so desperately or hoped for what you actually have today, right?
Yeah.
And the reason I put that was because I am retired, right? And I should be right now, just completely free to do all the things that I want to do. And I think something in my own energy causes chaos around me. And I just have so many different little chaotic things going on that I have to deal with, that I was thinking, I need to just like chill and have some serenity. I was just saying that to you.
Yes, and
So
I said to her, she's earned it. So
thank you.
And I mean that from the very bottom of my heart. Hey, we are saying hello to 2008 Rafix, and we're saying hello to Rawa. Okay, and I see what your question is. And we're saying good morning to our Journey Cameron's New Life. We're saying good morning to all of you. We are live right now, if you didn't know, on Facebook, YouTube, Twitter, and about a dozen other sites. Traven's going to start to show you that in just a second. We also want you to know that this will be podcast later on, and it will be available wherever you get your podcasts. And it's a free download wherever you get your podcasts. We really encourage you to be liking, sharing. One of my favorite things to tell people to do, if you're finding what's anything here that you like, right? And we do a lot of different programming with a lot of different focuses, but if there's anything on the Autism Network that you like, one suggestion is, if you have friends that you feel would benefit from this information, is to put their name in the chat on Facebook. That way they don't have to go looking for us.
Yeah.
It sends them a notification. It says you've been tagged in a post, and then they can come right to the feed and they can watch it later on, what you're watching right now. So if a topic that we hit on, you're like, oh, we were just talking about that, I suggest asking them beforehand before putting their name out there, but it's a really great way to let them know. I also want to encourage you, we love it whenever you guys do a review of us on iTunes. I have to tell you, that helps us to reach more people than any single other thing that you could do.
Wow.
So if you review us on iTunes, what that does is it gives us a bump on the podcast registry.
Interesting.
And so when people are just looking for podcasts or looking for podcasts about autism, it moves us further up, and so they're more likely to find us.
That's great.
So we enjoy that. We also have a Patreon now, if you like what we do here. It may be that you don't have any money to spare right now, but if you do and you want to help us to stay afloat, we encourage you to do that on our Patreon account. Traven will show that to you. Also have to remind all of you that we've got this amazing podcast-a-thon that's coming up in April. It's called the Autism Network Podcast-a-thon. It is 44 hours, live, nonstop. It is crazy, everything that's been happening towards that. We've got a lot of amazing guests coming. We are going to have some fabulous takeovers by other podcasters and by other organizations, but there will be a lot of Ask Dr. Doreen, where you'll have the opportunity to ask her questions. There will be some fun guests on Autism-Live. We've got some celebrities lined up. It's going to be super duper fun. So you'll want to check that out. That starts on April 4th and it goes through April 6th. We'll be live all the time. So for those of you who watch us in podcasts in different countries around the world and say to me all the time, I never get to see you live, well, you will for that 44 hours. We're saying hello to Ill-Minded, and we're saying hello to Liliana from Riverside. And we've already got some questions, and I'm just gonna hold on to those for a second, because our topic today, our overriding topic, is debunking myths about ABA. And somewhere, I had a piece of paper, it's here, I do have it. We had a couple of starter questions that have come in the recent weeks that we thought, ooh, we really need to do a refresher on this, because there's a whole lot of people who think a whole lot of things about ABA that may or may not be true. So a very fan favorite one that people write in a lot and say that they are concerned. They say, is it true that ABA grooms children to be taken advantage of by would-be molesters?
Oh my gosh, that's
horrifying, right?
It's horrifying, yeah. It's horrifying to even think that, but I often wonder how these thoughts come about. And I think, you know, there used to be for a really long time a kind of belief about ABA that it is so strict that it produces little robots or kids that are not, they don't have free will, they don't have the ability to be assertive or protect themselves and so on. And so because they were so compliant, anyone could take advantage of them. So I think that is where this kind of question is coming from. And you know, you have to realize that there's an aspect of teaching that is somewhat strict. It's not really strict, but like if you would think of going to a classroom in a school, that is a much more, let's say, strict or regimented or rule-governed environment than, you know, being at home, as an example, right? And ABA is the same thing. Because we have a short period of time to teach a very, very large amount of information, there have to be some rules around behavior. And those are things like just compliance. So, you know, when I ask you to come here and it's time to learn, you have to come here and sit down and we want to work. Just like a student goes to school and during class time, they have to behave and listen to the teacher. It is exactly the same in that sense. I would say it is very pro-free will because in ABA, we actually teach the child to request things that he or she may want. And if we didn't do that, children with autism who have delays in communication tend to use difficult behaviors or challenging behaviors to communicate. So in ABA, we teach the child not to tantrum or hit or aggress, but to use words or to use iconic communication to request the things they want. One of the things that they learn to request is cessation. So stop bothering me, I need a break. You know, stop giving me a demand, I want to go outside and play. So those are things that we teach the child, which I think are very important. And we also, you know, further down the line, once the child has learned some communication, there are lessons where you teach the child how to be more assertive. So that's actually a lesson where you're teaching the child how to deal with bullies, for instance, in school, or how to know what's right and wrong, how to defend themselves when someone tries to coerce them into doing something that they shouldn't otherwise do. All of these types of things are things that you will learn in a good ABA program. So, you know, the answer to that is absolutely not. Yes, there is a certain level of following the rules that are taught, just like a child going to school. But then there's also a lot that is taught in the content that is more protective in nature.
Yeah. You said at the beginning, you said, I don't know where these rumors come from, and I can tell you exactly, because we have them right into the show, that adults that are on the spectrum that had not good ABA,
right,
that then were later taken advantage of and feel like it was because they were taught that you're not allowed to say no.
Right.
And I love that you said it's really about what are you teaching?
Yeah.
And I think as parents, this is a subject that's very important to me. As parents, you know, when we get involved with ABA, this is one of the things where we need to be watchdogs on. What is your child being taught? Yep. Is your child being taught to advocate for themselves? Is your child being taught to say, stop, I need a break?
Right.
Is your child being taught to say no? One of the incidents that looms large in our life was that my son was getting speech therapy at school, but they called it lunch bunch. And it was once a week, and you would get together, and it would be a group of kids, and you would play games and have lunch together because they would be working on building language with your peers.
Nice.
Fabulous. And it was run by, like, we had the best speech path in the world.
Yeah.
But then she got a student teacher who came in, and she's teaching the student teacher, and there was one day when she had to step out for just a minute. And this is how things happen, right? But the aide, we had the best aide ever, was there. And so the student teacher said, we're going to do things a little bit different today, and we're not going to play the game first, we're going to do something else. And my child raised his hand and he said, well, why are we doing that? And her response was, because I said so.
Oh my God, I hate
And my
that
child
response.
said, well, that's weak,
Oh
right?
my God.
And then he lost a sticker for being disrespectful.
Yeah.
So that he didn't get his treat at the end of the day. And he, who understands, and justice was a very big thing with him, he was like, that's, you know,
Unfair.
he didn't
That's
say
where it's
BS.
not
He said
fair.
that's not right.
Yep.
But then I showed up And, you know, everybody was like, and your mom is going to tell you that you needed to be respectful.
Yeah.
And I said, what were we teaching? Were we teaching respect in that moment? Because respect is an important thing to me, but he wasn't there to be taught respect. He was there to learn how to talk to his peers. And talking to your peers and saying, that's weak, totally acceptable.
Yeah.
No, he doesn't lose the sticker.
Yeah.
And everybody was mad at me and said I wouldn't follow through. And I said, you're not paying attention to what you're teaching.
Yeah.
And we went home and I said to Jem, I'm always going to take your side.
Yeah.
Always going to take your side.
Absolutely.
And it was but that was a moment where things didn't go well at school,
yeah.
but things went really well between me and my child because I followed what are we teaching, and he did what he was supposed to do. And I said, always feel, and they said, don't you feel like he should never speak that way to a teacher? And I was like, are you out of your mind? If the teacher is doing something, who says to a child, because I said so?
That's exactly right. And that's exactly what I talk about, Shannon, when I talk about being fair. Because
exactly.
Even as a teacher, you're not allowed, you shouldn't be allowed to remove all the contingencies that are where the child can actually get rewarded. I mean, he is coming to that environment because he expects some process to take place where at the end of that process, he will be rewarded for having a certain behavior,
yeah.
right? It's like us going to work. What if someone suddenly came and said, you got to keep going to work, but we're not going to pay you anymore?
Yeah.
I mean, that's just not okay. It's
right.
not fair.
It's why they have riots all the time in France.
That's right. That's
right. Right? Because it's not fair.
Yeah, yeah. Exactly.
And our kids need to be allowed to protest when it's not fair, when they're with people that they know or don't know.
Right.
And I felt that was important. Our team felt that was important to teach my child. School had a hard time with that.
Yeah. And, you know, going back to this particular question, so there are, as you know, unfortunately, there are in the world people who do take advantage of our kids, and we're talking even neurotypical kids. I'm not even talking about kids on the spectrum, both on and off the spectrum. And that is simply because children are very small, and they are. When a large adult comes up to them and attempts something that they don't know how to deal with, they are intimidated, and they have learned to be respectful of authority, which is a good thing, but they don't differentiate fast enough that what this individual is telling me to do is not right, because they've never had that occur before. And they've always listened to adults in authority. And so it's very hard for a young child to actually say, no, this is wrong. I'm not supposed to be doing, you are bad, and I need to get away from you. And that is, it has nothing to do with ABA. It simply has to do with the fact that children learn to listen to adults and trust adults and see adults in general as individuals of authority.
Yeah.
So it's a very sad situation, and yeah, we all have to teach our kids to differentiate what is right and wrong and to quickly react to those situations, because once you are overtaken with fear as a child, you freeze. You don't know what to do.
There's a new show that's been airing, and I can't think what the name of it is, but there's two hosts, and there's all these parents, different parenting situations, and they're comparing parenting styles.
Interesting.
And they give them challenges of things that they have to do, and
Interesting.
then all the parents get to weigh in on what they like, and they get to vote who gets to stay, because they're trying to find the most effective parenting style.
Interesting.
I wish that they had allowed a good ABA parent to participate in this. It would have been so much fun for me. But one of the challenges that they gave was similar to, because there came a day when they had been prepping Jem, and then we had to go through a stranger danger alert thing, where my husband, I couldn't do it. My husband had to walk away from him in a Walmart, and they had people stationed, and they had someone go up to him and say, hey, I've got a puppy, can you come help me in my car, to see what he would do. And he had been trained extensively beforehand, and he handled it, he passed with flying colors. But they did something similar to that, where they sent someone to the door And the parents had said, we're going to be in the back for a while, be here. And the kids were watching cartoons. And somebody came to the door and said, we heard that there's a gas leak. Can you let us come in?
Yeah.
Or I've got puppies in the car, whatever. And then they showed this. And the parents, and these are all neurotypical kids, and the parents lost it.
Yeah.
Because some of the kids let the people in.
Yeah.
And the parents were like, how could this have happened? And
Right.
one parent got up and left and said, you're not allowed to show the tape with my child. I haven't been able to sleep. And it was interesting to see the different parenting styles and which kids knew not to go to the door and just completely ignored it and who didn't.
Yeah.
The takeaway from the show is that, they've been talking about the parents' emotions, and that sometimes, you have to teach your kids things. You can't just be laissez-faire and say it'll be whatever.
Absolutely. But
and I thought, we did this with my kid with
Exactly,
ABA. That's
exactly.
where ABA is good. We
Exactly.
taught him exactly what to do, and then he did it. We
Yep.
practiced it, and then he did it.
I mean, how many people even think of teaching their children through something like stranger danger?
They
We
don't.
Give
This is
give
what
our
I
kids
discovered.
some rules, right?
Yeah.
Don't talk to strangers, etc.
Yeah.
But we don't actually practice it the way that you did.
Yes.
And that's so important.
So ABA can be really helpful. I don't know whether to continue on with these, or we've got a lot of questions that have come in. Maybe we should switch to those for a minute.
Sure.
Okay, so how do you decide school versus ABA? Rawa
That's a
wants
great
to know.
question, Rawa. And so there's so much that goes into this. I'm trying to think. So the way that generally speaking, if the child is below the age of, let's say, 5 or so, then you're doing all ABA, in my opinion, right? So you would be doing as much ABA as you can prior to school age. When school starts, for me, school is a place where two things occur. One is you learn academics, and perhaps you'll also learn some group behavior. And the second thing is you have an opportunity to socialize with others, right? And so if your child has the capability at age, let's say 5 or 6, to benefit from that, so they can go to school, they already have adequate language, let's say, to understand now all the rules of school, and also to be able to do classwork, right, academic work, and academic work is now important. And also they are socially adept enough to be able to benefit from being around other children, then yeah, it's the right time to go to school. And if your child continues to have needs, look at ABA as tutoring, which you would do after school. So, if your child's at the point where, yeah, they can actually participate in academics and they can benefit from being around other children in school, then you're putting your child in school, and then after school you're doing ABA to catch them up on the skills that they're still delayed in. In most cases, our kids need a little bit more time to do a little bit more intensive ABA. Usually our kids are not ready to reduce their ABA to, let's say, 10 hours a week at the age of 5 when school is imposed on us. So in those cases, I often recommend that you introduce the child to school for fewer hours than 30 hours a week is usually when we start. But to introduce the child for, let's say, 10 or 15 hours a week to school with a trained ABA shadow. So there's one of your therapy team is with the child in school, teaching the child how to follow the rules, teaching the child how to pay attention to the teacher, helping the child with the academic stuff that's going on, and mostly teaching the child how to interact in free time with other children, and then bringing that information back to the home or center and doing practice and teaching the core skills in ABA. So in most cases, what I recommend for 5-year-olds who've already received, let's say, a year at least, or maybe even 2 years of intensive ABA, is that in their 3rd year, they'd still be doing something like 20 hours of ABA or 25 hours of ABA, plus another 10 or so hours of school. And as the core skills increase, you want to use those young years as much as you can to teach intensively, right? And as those are increasing, then you can reduce the intensive ABA tutoring and increase the school. It's going to be different for every child, how you do that transition. But really, a lot of times parents think that if they put the child in school at an early age, the child will just learn to socialize. Yeah. They don't. The child will not learn to socialize on their own without having some key skills that need to be taught first. And then what happens is the child feels isolated, left out, bullied, made fun of, cannot interact with other kids. School becomes a failed experience. It's not a successful experience. It becomes very, very important to make sure your child has the tools to go into school and have a very successful experience. So that depends on what he's had before school age, and also his level of functioning. Like, realistically, can your child communicate well with other kids? Can they attend to what's going on? Can they look at other kids and the teacher to know what to do when they're lost? Do they have the skills to independently go to the bathroom, come back? Do they know how to play with other kids? Do they know how to interact during lunchtime? All those types of skills have to be taught so that the child has a successful experience in school. And that's what's going to dictate how many hours of each.
Okay. One of the things I want to add, though, because you were saying, parents, what parents think, but a lot of parents think, too, that school is all or nothing. That if you're going to go to school, that you got to go for 30 hours. So here's a little thing to know that, and this is tragic, but school is going to give you a hard time if you say that you're only going to bring them 3 days a week or 10 or 15 hours. They're going to lose their minds entirely. But here's the trick. The reason why they're losing their minds is because they're going to need to create a space for your child, and that means that they have to apply some resources to it, which means that they want to get the funding for it. Yeah. So most schools, the way they get their funding is if your child comes, there's a magic hour, and it's like 10:30. So if your child comes to school and is there until 10:30, they still get the funding for your child for that day, even if you take your child out at 10:31. Right. So, I say to parents, ask somebody that you trust outside the IEP meeting, what's the time that you need him there until so that you can get the funding. And then they'll tell you, and then you go in and say, here's our proposal, we would like to bring it, and it probably will be that you have to bring him every morning so that they get the funding, but then we're going to pull him out at 10:31. You're still going to get one person on the team who's like, they're going to miss out on stuff. Ignore them. Just smile and nod and ignore them. But the administrators will go, we'll take the money for your child not being here, and then you don't have to put up a big fight. Just wanted to put that out there.
No, it's very true. It's a really good point.
But let's try this. I'm skipping around the questions a little bit, you guys, because thematically, let's try this. Their question was, my daughter is in school full-time, no ABA available due to schedule. Is it possible for me to develop our own ABA type program for us to do on weekends and evenings?
Right, yes. So several things about that. One is that the school has to provide some aspect of ABA to you. You need to begin by requesting an IEP, called different things in different states, but basically it's an individualized education plan. When you go to your school and you tell your teacher or the principal that you need an IEP for your child, it starts there. And in that meeting, you will say, I need an ABA for my child. And the school will either have to provide the ABA or they'll have to pay someone outside to provide the ABA for you. And the someone outside is a provider of ABA, and there are literally, I think, thousands now throughout the country. Wherever you are, there will be an ABA provider. Now, the good thing is that for the last approximately decade or so, we have funding through health insurance for your ABA services. So now you have two sources of funding. One is your school district is supposed to pay for, this is the Free and Appropriate Education Act, which basically says if the school district cannot provide you what's appropriate to your child for free, they need to pay someone to do it. So your classroom setting has to be appropriate for your child. The instruction has to be appropriate. And there have been lots and lots of very wonderful parents who've gone to court against their school district, and over the years they've proven, and this is therefore now a precedent, that if the school is not providing a individualized program for your child in a way that is benefiting your child, they have to pay someone to provide that. So you could either go that route, forcing your school to kind of get you an ABA program, or you could just have your health insurance and you go to any ABA provider that is a good provider in your area. And we can certainly talk about things that make a good provider. Just go online and look up applied behavior analysis, and you'll get a whole bunch of companies, and you then sign up with them. They use your health insurance, your medical insurance, and then they will provide therapy to your child either at your home or in their center, one or the other. Those organizations also have the ability to contract with your school and also go into school to provide services. But if they do that, then your school has to pay for that portion of it, because medical insurance it gives them a very, very hard time if they're going to go on the school campus. So it's still very complicated. I'm sorry about that. Fortunately, though, there is some funding, and so you just have to kind of fight for it and get it.
And the problem becomes, and we have another question that involves this too, that a lot of times there's a scarcity of behavior technicians right now. And they'll tell you, we don't have a team for your child in the hours that you're available. You want to look at making yourself more available for the hours that they do, but sometimes you run into the school issue. You know, we can talk about that at length, but I said something last week that a lot of people went, wait, what? And I want to reiterate it again, that if you have insurance and your child needs ABA and you're not getting ABA because you're on a wait list, you need to go back to your insurance and say that this is a denial of access to care. Because what has happened is your insurance company contracted with a company to do your ABA, but now the ABA company is telling you that they don't have enough people. And it's your problem, right? No. And it's not even the ABA provider's problem, it's the insurance company's problem. You need to go back to the insurance company and say denial of access to care, and what they will do is they will, we've seen this happen time and time again, they will offer you a single case agreement with a different ABA provider that they didn't previously have an agreement with, so that you can get ABA started. And you need to tell them it's their problem to find you an ABA provider. Just make sure it's somebody that you want, that's reputable, that you're going to agree with. Yeah. You know, that's where it gets a little bit sticky. But a lot of times they'll say, have you looked around? Is there somebody that you want? Because they're having difficulty finding somebody too. But it is the insurance provider's responsibility. You're paying premium for that insurance. You got the doctor to sign the prescription. They need to find the provider for you.
Yeah, and what it's called is they have a duty to give you access to care. And so essentially they have to offer you other providers if the one that they first offered you is too busy. And so the issue is, though, that, and they do put it is their responsibility, the payer, which is the insurance company, but they put a lot of pressure on providers, and they tell the providers, if you don't give access to care for a lot of the people that I refer to you, I'm not going to put you in my network, I'm going to go work with someone else. So often they'll have multiple people in their network, multiple providers, and you just need to be pushy about it. But there is, you know, in this day and age, if you are pushy about it with your payer and with your school district, you shouldn't be waiting for services too long. I mean, I hate to say it, but a lot of these organizations still have wait lists. I know a lot of organizations have wait lists. And
it's common.
They're not really supposed to. Now, there is a shortage of well-trained therapists, so that's a whole nother side of it. But I feel like it's important for parents to know that they should have access to the right therapies. Yes. I saw another question in here that was kind of about whether, you know, is it best to work with one organization, or is it okay to have two different ABA agencies? And that's really an important question. It takes us back to the whole concept of what is high quality ABA, which we should really touch on. Yeah. Because you can work with two organizations if the two organizations agree to it, first of all. A lot of organizations will not agree to having your child receive treatment from someone else, and I'll explain that in a minute. So first you need two organizations that are going to agree to it, and secondly, you need them to be from kind of the same mind and thinking and have very, very similar programs, and also communicate frequently with each other so that they remain consistent. Even when you're working with a school and an agency, you have to produce that consistency.
Well, you had it happen exactly what I had happen, where they were saying to my son, you don't get your reward because you said something inappropriate, when that wasn't what we were working on.
That's right.
That's a disagreement, and those kinds of things affect the child.
They do, absolutely. And I mean, really basic examples of that, Shannon, would be something like, you would say to a child, oh, I'm going to reward this child every time, but we're at the point now where the child is speaking in 3-word phrases, so we will only reward the child if they use 3 words or more. But, you know, in a different setting, let's say school, the child might use 1 word and they'll be rewarded for it. That will interfere with the child's progress over time, because the child's now confused. They're like, wait a minute. 1 words get me rewards here, 3 words over there. How does this work? What do I need to do to get my reward? So those are the types of things that cause the ABA program to fail, because people are being inconsistent in their goals and what they require and how they reward the child. So that is very, very important. Can we touch for a minute on this whole concept of what is good ABA? And it's really tough. We've talked a lot about this in a lot of different shows, and also we've done presentations on this subject. So if you go back on our YouTube channel and search, you'll find this topic repeated. I also have done several videos of this on TikTok and Instagram and stuff about what constitutes good ABA. But there's a few different factors. I don't know that I'll remember all of them here. We'll try to hit on them. Please jump in, Shannon.
Yes.
So to begin with, it needs to be individualized. That means there has to be a really comprehensive assessment of your child done in the beginning, and pretty frequently, I'd say every 6 months from there on. And this assessment identifies exactly what your child needs. Every child is different in many ways. Not only are they different in the areas they need help with, or the areas they're weak in, they're also different in their style of learning. They're also different in the speed of learning. They're also different in the things that are rewarding to them. They're different in their sensory input. All of this stuff needs to be taken into consideration. So one child might be a visual learner who is best rewarded by giving breaks and gets bored quickly, so you need to keep the pace up. And or another child might be not a visual learner, where it's not important to give visual cues, and they might have a longer response time, so you need to slow it down and give the child enough time to respond. There's all these things, right? And then in terms of the skill level, you know, autism is a huge spectrum. So you might have one child who is completely nonverbal, has absolutely no ability to have eye contact or to imitate or have any kind of interaction. And then you might have another child who is verbal and only really needs help in the social abstract language area. And both of these children are diagnosed with autism. So it's very important to do an individualized program, and that always begins with an assessment of the child. Lots of organizations use different assessments. I just recommend that you feel that, first of all, when you do the program, they don't just come in and say, this is the program we're going to do. That's going to be cookbook, and it's not going to work. The first step is always going to have to be an assessment. And when they give you the results of the assessment and sit down with you and say, these are the areas we feel your child is weak on or needs help, and these are his strengths, that you agree with that, and that it covers everything you can think of that you feel your child needs help on. So these could be across language, play, social behavior, abstract thinking, motor skills, academic, I mean, you name it, all area, adaptive, like things at home, self-care, everything has to be covered, okay? So that's one thing. Second thing is, make sure that if you are, if your child has a lot of needs, and they're younger than, let's say, 8, then you probably need about 40 hours a week of one-to-one instruction, ABA instruction, to cover all those needs, right? If I have 10 hours a week, I'm not going to be able to teach language and cognitive skills and social skills and academic and adaptive.
Because 10 hours isn't enough. I want to make sure that everybody understands that part.
It's just not enough, right? And when you see a comprehensive evaluation of your child and you see these like literally hundreds of skills that they've fallen behind on by age 4 or 5, you realize, oh my God, I need to work really intensively the next couple of years at least to teach as much as I can to my child, because as soon as they're 6 or 7, the world now expects my child to also add academics. And so now I don't have any time left once my child is 7 or so. I have very little time left to teach them more basic skills like language and adaptive and things that are very important to their life, right? That's why we do early intensive behavioral intervention, what's called EIBI, which is ABA, but for the younger generation. So like kids from birth to, let's say, 5. And that's where you do very intensive work, because your goal is to teach the child as much as you can before academics is piled onto it. Okay, so that's the second thing, is that it's got to be intensive. The third thing is that the child needs to be successful. So you always have to have a behavior analyst, a BCBA, board certified behavior analyst. There's a few other credentials that are pretty close to that or equivalent to that. Someone with experience in ABA who is flexible with your child in terms of making sure that if things are failing, they modify the program constantly. I gave an example earlier of children who learn visually. A child who needs a visual prompt, and there's a lot of kids who have a hard time with instruction that's given auditorily, but they do very well when the instruction is visual. So it's either a picture or written words or some format like that, then they do really well. And if the BCBA, if the person in charge of your program is not paying attention to that, they will continue to force auditory instruction, because most of the stuff we teach is auditory, right? Do this, what is that, show me, bring me, tell me, etc. It's all vocal instruction. And if you don't move that program into a visual program where the child receives more visual instruction, your child's going to keep failing. They're going to keep failing no matter what. And the program will be stuck where it is. Whereas if your BCBA is astute and paying attention and has now realized, oh, this is a visual child, they need more visual prompting, and they change the program into visual, then your child will thrive and they'll learn and they'll do really well. And so it's very important that at any given time, if your child plateaus, and listen, ABA, all ABA professionals are very good at taking data, so they should be showing you the data, and you should be seeing that your child is learning these skills over time. And if that happens, that's great. If your child gets stuck and the BCBA or the ABA organization doesn't know how to fix that, that's a problem. Now, one of the things that helps fix that, which is item number 4 of being very important, is that ABA organizations tend to forget that the child they're working with is a human being. That means this human being needs to be sleeping well, needs to be feeling well in order to learn well. Now that, I can't emphasize that enough, because that was something I used to repeat over and over and over when I was teaching people at CARD, because it was all about, like, you're thinking of a 4 or 5-year-old and you're doing 40 hours of intensive tutoring. This child better be sleeping.
Yeah.
And if they're not sleeping, or if they have a diet that is causing them to be inattentive, like they're receiving a lot of sugar, a lot of red food coloring dye, or if they have medical issues, like if they have high yeast levels or gastrointestinal distress, any of those things, that's going to interfere with them feeling well. It's just not going to allow them to sit down and receive all that information. So one of the things that was very important to me was making sure the child's medical situation is in good shape. Just like a child goes to school, a typical child goes to school, and you realize, they're not able to see the board. Maybe they have visual issues, and you go and get them glasses, and then all of a sudden the child is paying attention. Same thing with our kids on the spectrum. If the child's having a hard time because they didn't sleep every night, they're up, or because they have stomach problems, or because they're constipated, or because they have some reaction to a food they had, or candidiasis where their brain is foggy. All of these things have to be dealt with so that the child can actually sit down, pay attention, and learn. So these are very, very important things. Then I would say another part of this is making sure you as the parent are involved.
Yes.
If an organization does not involve you, does not provide you with training, does not provide you with education about autism and about ABA, they're lacking. Because the parent, you are a big, big, big part of your child's treatment team. You're the one that really, first of all, you're the boss. Like, you will always be the boss. You need to be the boss. You're the one saying whether or not things are working, what things you think they should be working on instead of what they are working on. Like, it all comes down to what you see, how you feel, what you report, if you see progress, if you see problems, all that sort of stuff. And so you need to be part of the team. In order to be part of the team, you need to learn some of the basics of ABA. That was a very long sentence.
No, but it was brilliant, and everybody's freaking out. So we've got so many questions and things going on, and I didn't want to slow you down because it's all important. And I want to say, Christy said yes, the whole child. Okay, and people are freaking out saying, I didn't know that there could be ABA in public school, and I didn't know that
Wow.
But yes, there's a lot of things here, though. And how people are struggling to get services. I want to start with, and I'm going to get to as many questions as possible here. But Amanda says, do you guys remember when I told you that my son got 36 hours of ABA approved? Yes, I remember celebrating that. That same company called me and said that they have to pause because of staffing issues until June. My son has been without services now since October, and this was after they had approved the hours. So I'm so glad that we talked about the denial of care, and I hope that you're going to ring them up, and the insurance company, and tell on them. Joannie says, we are struggling to find a provider that will work with a 10-year-old. He still has a lot to work on according to skills. This is a common tale.
This is a common tale, Johnny, and I hate this because the truth is, and this is like one of those truths that no one ever wants to say, I'm going to say it here.
Yep.
The truth is,
I'll hang on.
You get a ton of pushback from payers when you're a provider, and it's so wonderful that I can actually say this now. The truth is that the payers, that's the insurance company, puts a ton of pressure on providers and says, hey, I'm just not going to contract with you if you continue to recommend ABA for kids over the age of 10, 12, whatever. Or if you continue to say that intensive ABA is necessary past age 6 or 8, whatever. Because it is true, there's the literature that has been published on intensive ABA usually has to do with very young kids. But we do know that ABA, there's thousands of articles showing that ABA works lifetime. Like, we're talking adults, seniors, it continues to work. It's a teaching technique that is very, very effective.
Absolutely. Judy says, I've been fighting my school for services after she was mainstreamed. The services quit, and she has been tested for the last 2 years, qualifies, however, had to get an attorney, still fighting. She goes on to say it's a trauma struggle for her. She's going downhill health-wise and sees a therapist weekly, and she says, you are so right, ladies. It's so hard because whoever you're fighting with, there's always somebody to fight with.
It's unbelievable.
But I do want to encourage you to, especially for the school stuff, look at our YouTube channel. We did a whole series with Bonnie Yates about school, and you know, it's different than insurance, right? Because insurance, you know, you're paying the premium, but with school, the difference is that you have that, as Dr. Doreen was saying earlier, you have that right to that free, appropriate public education. So I'm glad that you're fighting it with an attorney, and I hope that they are getting things to move fast, because meanwhile, if your child's health is failing, I don't think that that's something to wait on.
Definitely.
But Bonnie had lots of advice for if you need to take your child out of school, you know, because you have to give them 10 days written notice before you do that. If you feel that what they're providing is not appropriate, you literally can take your child out.
Yep.
But you have to give them 10 days written notice. That's all in Know Your Rights. There's a whole playlist on YouTube. I want to get to this one. I think it's Lucy, says, how can we argue and state our case that our child still needs ABA after 6 months of 35 hours per week? What can we do to get the insurance company to approve another 6-month extension? It's a 5-year-old child who has lots and lots of repetitive behaviors and restrictive routine habits. What can we do? And this, I read that and my chest got tight, because it should be a no-brainer. That they should continue to have 35 hours.
So let's touch on that one real quick, and then I think we have already on our various websites, but we should make sure that you have access to literature that proves that ABA is effective. And I want to say that, you know, 6 months is it's enough time to just get a baseline. It's not the prescribed amount of time. Generally speaking, for a young child, the literature published scientific proof says that we're talking 2 to 3 years of ABA. The payers, the insurance companies, decided that they want to do an evaluation every 6 months, which is great, but that doesn't mean that at the end of 6 months we're done by any means, like especially for a child that's got a lot of repetitive behaviors and routines and so on. So what you do is you essentially go back to your payer. If they've said no, if the payer has said no, then you appeal that and you say, here's all the literature, and you send it in. It's just a form, appeal form, and you send in with it all the literature that says ABA is effective and has to be done intensively for 2 to 3 years. Shannon, what is the best way for us to get that information to them? There's like a list of articles.
I have the top 6 studies always on my computer. If you'll write directly to me, I'll forward them to you. I'll send them to anybody. So my email is shannon@autism-live.com. And we've had people for, you know, over 10 years take these in, and it just ends the conversation.
Yeah, and maybe we should
you just have to stack them. You really could take a stack of paper and say, I have these studies, and have nothing printed on them. They know the studies exist, and when they know you know it, it like ends. But I have them if you'd like them.
It's so true. But can I also just, since we're talking to Lucy.
Yes.
You have a 5-year-old who has a lot of repetitive behaviors and restrictive routines. So I want to ask you to also maybe get an evaluation and figure out if your child also has some anxiety. Kids who have a lot of routines tend to be trying to gain control of their environment by doing repetitive things. And sometimes they benefit from anti-anxiety medications as well. So perhaps it would be good to do an evaluation of the child, get a psychologist to do an evaluation. That's actually will help you with the insurance funding as well, because if you get a psychologist to do a skills evaluation, as well as an evaluation for, you know, just the areas of need in autism, as well as the possibility of anxiety, they will write a pretty comprehensive report. That report can then also go back to your insurance company indicating that your child continues to have needs that should be met. And that's very important as well.
Okay, so the email again is shannon@autism-live.com. There's so many questions, you guys, and I feel bad because we're going to have to not get to all of them.
We'll do our best.
But I do want to say, Christopher has written in and said, we're in the process of getting our son evaluated. We had multiple people say that they think he's on the spectrum, but his teachers don't think so. That's, I'm a former teacher. It's lovely that teachers have opinions, but teachers don't diagnose. Speech is delayed, nearly 6 years old, but seems like he's more 3 to 4. While his teachers are very supportive of us and him, he is struggling. Any suggestions? I think, they said they're in the process of getting the evaluation. I just want to say it's lovely that the teachers are supportive, but you don't go to the hardware store looking for spaghetti and milk, right?
Yeah.
Teachers don't diagnose.
Yeah, and it's actually really important for you to, and BCBAs don't diagnose either, board certified behavior analysts, so that's very important that you know that you need to go to a developmental psychiatrist or a psychologist, a clinical psychologist, to do the diagnosis. And it's important not just to see whether or not it's autism, but to figure out what else it is. Because clearly your child is struggling, so we need to figure out what is causing him to struggle. And so that would be a psychologist or a developmental psychiatrist.
And the current diagnosis, he says, is adjustment disorder and ADHD, but they're working on ADHD and autism. Getting that one.
Yeah. And if ADHD could be leading to some delays as well, and that needs to be treated as well. So, like I said, it's just important to know what the cause is.
Absolutely. Skylar says, I'm an RBT who has been in the field for 3 years. How would you discuss with parents how to help them see the need of waiting out on crying in order to get them to appropriately manned for their needs?
Yeah.
It's a great question because it's a hard one, right?
It's a great question, Skylar, and you should have the BCBA that is in charge of whoever you're working with have that conversation, quite honestly. But since you are so dedicated and you want to have that conversation with the parent, I think you just try to start by, what I used to do is I would always start by trying to explain that challenging behavior is a way to communicate. Children communicate by crying, for instance. And you explain to the parent, it's so funny, crying is an interesting one because all babies start out crying to communicate, right? They cry, and we learn as parents, we learn what kind of cry it is. Is it a cry for hunger? Is it a cry because they need to be changed? Or is it a pain cry? We know or is it a cry because they're just tired, right? Yeah. So we know the sounds of those and they're different. As the child gets older, what do? If it's a neurotypical child, we start to not accept the crying, and what do? We say to the child, use your words, right? So when kids come up and they're crying, and you're like, calm down, use your words, tell me what's wrong, and so then they start to use their words. And that is exactly what you're trying to do here. You're trying to teach the child not to cry to communicate, but to use their words, their mands. And if you explain that to the parent, what happens with kids, parents of children on the spectrum is we just give the child too much time. We assume that the child is not able to use their words to mand, and so we try to figure out fast and give them everything they want when they're crying. But I think if you explain that, this is also what we do with neurotypical kids, it's the same exact thing. If you explain to the parent that as long as you give in when they're crying, you give them what they want when they're crying, they're not motivated to use their words. And the moment that you stop doing that, the child will first increase, as you know, the extinction burst, and they'll have more crying, but then eventually, and as long as we prompt it and model it and make it easier, the child will use their words, and that is something that's so vital for kids.
There we go. Karen says, hi, thank you for your valuable information. For a nonverbal child who currently communicates with word approximations and gestures, such as pointing, would you consider PECS, speech chat, Dynavox? I'm not sure what would be our best first AAC option, and thank you.
That's awesome. I often use PECS first, just because it's easier. And it's a bunch of icons, and you can actually produce there's something easier for a young child when they kind of physically remove, like a picture that's on a Velcro and hand it to you. Produces more of a communication than if they're touching a picture on an iPad. So I often start with a PECS program. I just love the PECS programming. And I'll make multiple poster boards all over the house for the child. And then you can go to any of the augmentative, you can go take that into the iPad. But I think it's important first to get the child to understand just the concept of, I give you this icon, I receive something, right? I give you a picture of juice, I get juice. I give you a picture of swing, I get to go outside. Whatever it is, they need to realize that this thing is my communication. And then as they do, and of course, if it's a semi-verbal child or vocal child, you can, I would first just accept the icon, but then I would try to imitate the sound going with the icon as well. A lot of parents are concerned that if they use iconic communication, like non-vocal communication, the child will stop talking or will never learn how to vocalize. And so you can imitate the sound when you're giving juice and receive the approximation from the child, but don't do it all at the same time, because this is important. When you're trying to work on vocal imitation, work on vocal imitation. When you're trying to work on the child communicating a request, that's all you're doing. You're not fixing the vocal imitation during that process of what we call manding or requesting things. Because the child has to learn at some point, hey, if I want something, I'm going to give them a thing and I'm going to make whatever sound I can about it. Separately, you're trying to make those sounds closer approximations to the actual words they should be.
Great. Can I squeeze in one more? Because they wrote in right at the beginning and then we got off. But how to increase awareness in a 9-year-old so that he begins saying hi and goodbye?
So that was, I saw that question earlier, and that's a great question, and we can end on that. It's not about teaching awareness in order for that to occur. It's about teaching that specific skill first. So it's a lot of modeling, so that every single time that you see anyone where the child is supposed to say hi, and you don't do them at the same time, hi first and then bye, you will say to the child, say hi, and the child will imitate hi. If it's a visual child, you can actually give them like a written word hi, but you prompt it and the child says hi. You do that 1,000 times.
And you reward,
and
right?
you reward it, and you reward it every time. Good job, that's awesome, hug, whatever is a reward for the child. And then you gradually fade yourself out. So this is how we teach in ABA. You model first, and then you fade the prompt out. So you now, instead of saying hi, you might just use the mouth movements and say, or you might say, ha. And whatever it is, you fade it out, so that the child starts to learn that they do it on their own. And then once you've gotten that, you do bye separately. And before you know it, the SD, which stands for discriminative stimulus, the symbol that triggers for your child to say hi is when they see a new person. And the symbol for your child to say bye is when they know you're leaving. And that becomes the thing that they become aware of. Otherwise, it's too hard for a young child to just be aware of the social nuances involved in social conversation. That's not exactly how they learn. They learn through those specific symbols that trigger them to say something.
And it takes a long time, but you get there.
Oh yeah, for sure. Hi and bye is one that you'll get.
You just keep on doing it. It will happen. Yes. And even if they're nonverbal, they can wave hi and goodbye, and because they said that has functional speech, but it's still hard for him to say greetings like hi and goodbye without prompting. But he'll get there. He'll get there. All right, we're out of time.
It was a busy session. We should do something on ABA, like maybe during the marathon.
Absolutely.
Because it looks like people have a lot of questions.
Absolutely. So make sure that you guys are tuning in It's February now. Today's February. But April 4th through the 6th, the marathon, we're calling it the Podcastathon. The Autism Network Podcastathon. 44 hours live, nonstop. I'm planning on having bags underneath my eyes
my
that I can
gosh.
pack New Jersey into. But it'll be really fun. Hey, we got a great show for you tomorrow. Can't wait for you guys to be here. I hope you all have a wonderful Valentine's Day, and thank you so much, Dr. Granpeesheh.
Thank you, and happy
always a
Valentine's,
thrill.
everyone. Thank you.
All right, we'll see you tomorrow. Until then, give your kiddos a hug from me and one for you too. Bye-bye for now.
Bye, everyone.
Don't forget, you can watch Ask Dr. Doreen live every Tuesday morning at 10 a.m. Pacific time. We hope to see you there.